Hello everybody, this is Dr. Tran. Welcome back to my YouTube channel. I'm a chiropractor, a rehab specialist, acupuncturist. I do all those three, and today is a special feature video on shoulder and rotator cuff injury. Dr. Le, who currently lives in Atlanta, he's a friend of mine. He texted me yesterday and asked me if I can show him some exercise for his rotator cuff. And since he lives so far away, I cannot help him. So here's some exercise for him, but as well for anyone who like to try some and unable to go to a physical therapist, a chiropractor, or a doctor that can help right away. So remember, this is not replaceable for you to see, a doctor. So make sure if you have shoulder problems, seek professional help. So the most important thing about shoulder is one of the hardest joint to treat because the only joint that can go 360, you can see. So a lot of time, injury from shoulder doesn't have to be obvious. Most time it's actually not obvious because you can easily get up from a chair and you get like that and you can sprain a muscle, but you forget about it, and then over time things start to compensate. So one of the thing is make sure you seek specialists to examine the shoulder before and figure out what's wrong. But let's say if you can't find one, so I have some of the exercise I can help to ease them up. But the most important part is the compensation. So most people, when you have chronic shoulder problem, when you lift your arm, you see, if I lift my arm normally, you can see my arm look like that. But for people who have chronic shoulder injury, this is what they do first. They go like that and up. You see how that and up slowly create frozen shoulder? So anytime your shoulder do that, you know you have injury a lot longer than you realize. And that's the hardest thing. If you don't get treatment right away, your trap becomes overactive. It's already overactive even if you have no shoulder injury, because when you stress out, you automatically go like that. And for those of you who have carried backs on one side, you tend to go like that anyway, on the phone. So this trap is already overactive or hyperactive. And then when your shoulder hurt, most common injury of the shoulder is the muscle right underneath this, right here, underneath this groove right here. It's called the supraspinatus tendon because it's to go between the top and the bottom joint here. So when you slouch like that, you have poor posture. You start grinding on the muscle, the tendon right here. So anytime you go like that, instead of just normally lift, you tend to go like that first and lift. So what happened is there's a gap between your humerus head, your arm, and your shoulder capsule. So when you move your arm, they glide this way. You see? So when you have injury here, your trap pull it slowly, go close the gap together. That's why you can't glide anymore. But that takes months and months. So now if you just go and do exercise to try to, go strengthening, you actually make it worse. So you have to be very careful on figure out what's wrong first before starting the exercise, especially with weight. Because remember, the trap are much stronger than some of the injury muscle. So to start out with any weightlifting, you're going to compensate by using the strong muscle. So if you keep practicing, you get stronger, but you actually create more damage to the joint. So the first exercise I would usually do is, just lift your arm up and see how far you can go. And if you can't, just any range of motion you can move, at least move it 15 times, 3 or 4 times. And then the first exercise of the day is called the pendulum, okay? So one of the key joint to treat a lot of the joint is the less movement you do, the more easier it is the joint to dry up. So with the shoulder, usually if you go like that, it hurt, then you stand like this. You can put your hand on the bench, the table, the counter, whatever, and then lean over like this, slightly bend your knee, and let your arm dangling about right here. And you go up, down, like that. And then if it's getting easy, then you can actually hold a water bottle or a couple pound weight. And you can do the same thing. And loosen up all the shoulder muscle, okay? So after that, good warm up. Then the next exercise I would have you do is you can start to grab a rubber band or TheraBand or something rubbery like that. And even if you can, just a towel is okay as well. We can do isometric exercise. But let me show you with this band first. So we do external rotator. You can actually put both hands like this. You can go from here, just bring your shoulder back, down and stand up straight, and from here just pull it out gently. Now if it hurt, then stop. Just do it as much as you can. Hold it right there and then come in slowly. Now if you can, with two hands, you can actually also strap to a doorknob or something safe, and you can go out the same way. Now if you have a towel, then you can't move, but you can still do isometric exercise. You grab onto the towel and you just pull. So there's not a lot of movement. We used to engage the shoulder muscle. So pull them out like that, hold it. 1001, 1002, 1003, 1004, and pull it. And I would do this 12 times. Now remember, you have to do this slowly, okay? Because when the injured muscle is injured, it takes time for that muscle to activate. If you go so quickly, you will not be able to access the injured muscle. You only do, get the muscle that already overused work harder. So go like here, just pull like this, hold it and relax, hold it and relax, and repeat them 12 times, okay? I would recommend do both injured and uninjured shoulder. So that's called the external rotator. And then the next one we can go onto the wall, and we do something called wall angel. Okay, so this next one is called wall angel. Now, most people with shoulder injury is not easy to do this. It's okay. Just try to get the motion. Okay, don't force it. If it hurts, don't force it. And most of the time, what happens is you won't be able to touch the wall, but just try the motion anyway. Okay, so you start here, and then you just go ahead and straight your arm up to the ceiling. What you can, straight your arm out, and then go back down to here, and then go back up again. There. So just like that. Thanks, Doc. And repeat the motion, same thing, 12 times. So if you have issues, most likely your arm might stick out like this. So you might be able to just do like that. It's okay. Just get the motion, but don't force it, because you're gonna make it worse. All right, so that's the wall angel. Same thing, I would try 2 or 3 sets of 12. And then the next one is called shoulder protractions. So you put your hand on the wall, like so, and you can sink your chest into it and then come back out, into it, back out. So you're gonna bring your scapula together, like so, but try not to bend your elbow, because most of the time this is what we're trying to do, is bend our elbow. So lock your elbow out and just shrink in and out. So the goal is try to wake up this muscle and then allow the joint to move better. All right, so we have, let's go back to it quick. So we have the pendulum, we have the wall angel, external rotations of the arm, then we have the protractions. I'll show you 2 more. A lot of time you can't only raise your arm like this. So it's gonna help to go to the mirror or the wall or even the bench and just put your elbow up like that. And if you can put your hand like this and maybe slowly lean into it. So that helps you open up this gap a little bit. And if you impingement here, it actually tend to have more pain. So try to keep here and then shrug your shoulder down and get a little bit stretch. And you can play around with this by move your torso. So if you start here first and see how it feels, and then turn your body this way and see how it feels. Because many of my patients with shoulder injury, they can only get to here. So sometimes we even have to put the arm on the edge of the desk or table. If you have standing desk, you just put it here and just gently lean down slightly. Remember, you want to get some stretches, but don't hurt yourself, okay? And that way, when you do like that, any movement you can do, you can slow down the adhesion of the capsule. The last stretching of the day is called the sleeper stretch. You actually lay on top of your shoulder like this, put your arm here, and you can go to 90 degrees, and you can just push this arm down like that gently. Same thing, don't hurt yourself. Get some stretches, and then come back up like this. Those are some of the exercise that you can do for the shoulder. There's a lot more. So I would highly recommend, seek professional help. But for the time being, keep those up. Because one thing that really create a lot, just acute shoulder injury into a chronic, is muscle atrophy and adhesion. Because when you have pain, you tend to avoid to use it. And when you avoid using it, your muscle atrophy kicks in and you start compensation. And the longer that going, the harder it is to do rehab. Remember, physical rehab is, break away the bad habit that your body pick up because they try to compensate. So if you have any injury, fix it as soon as you can so that you don't pick up the bad habit. And then not only that, when you pick up bad habit, you relate to other area. Like I mentioned earlier, when you're trapped, you keep going like this, it's really damaging your neck as well, because your trap attached to your cervical spine. So if they keep overacting like this, it creates a tremendous amount of neck pain. Remember, the neck and the shoulder are connected. So if you have shoulder problem, you have neck problem. Because just imagine this, when you try to lift my arm, and I can, because it's hurt, I go like this. Every time I lift my arm, I have to lean over and like that. So my neck is being affected. Remember, any injury that you let go for a long time, it leads to other problems that you didn't want to have. So I hope this video helped. Any comment, questions, please do not hesitate to write on the comment below, and I'm more than happy to get it answered or even make other additional video for you guys to watch. And let's do this together. Stay healthy, stay well, and see you until the next video.